members. Integration is the main part of treatment to any one of the patient which are suffering from some challenging diseases. For example, in COVID, Tamil Nadu has a lot of integration centers where the patients are treated with modern medicine and Ayush medicines. And this is the successful way to manage the COVID cases. Yesterday, Prime Minister also informed about integration is the end part of the medicine. So everyone is going to participate in integration to challenge most of the diseases. First of all, in this first presentation of mine, I am going to share my experiences and my knowledge about Siddha system of medicine to all of the team members. Those are in different fields. And what is the basic principles and fundamentals of Siddha medicine? How and which way we are diagnosing a patient? What are the what are the types of our medicines? And what is the specialty in Siddha system of medicine when compared with the other Indian system of medicine? First of all thing, you can notice this picture. This is the important picture. It's a one surgery. We may call as a cranial surgery done by Agasthyar in front of Pandyan Emperor to excise a mass in the brain of a cranial cavity of one poet that is called Tolkapian. This is the message where Siddha was involved in surgical procedures, and the same skull was found in Tirunelveli district. So Siddha not only having external medicines and internal medicine, it has lot of surgical procedures. We have a lot of literature evidences in Siddha system medicine. But before going to the surgical procedures, in Siddha medicine, we are having three types of sources. For example, one is plant sources, and another one is animal sources, and remaining last is metals and mineral sources. This is the important part rather than other system of medicine, because in Siddha medicine we are using a lot of metal molecules in ash form by some incineration process. Some nanoparticles obtained from metals and minerals to give internally. This is the very effective in cancer and autoimmune diseases. So this is the specialty in Indian system of medicine when compared with other system of medicine. The classification of the Siddha treatment is based upon divine method, that is Vinnavar Maruthvam, and rational method, that is people medicine, and another is surgical medicine, that is Asurar medicine, that is Arvai, Acne, and Karam. It has 25 subdivisions. In general, we have 32 type of internal medicines and 32 type of external medicines. That is the treatment regimen based on Vinnavar Urai, Makkal Urai, and Asurar Urai. In Asurar Urai, we have Arvai, Acne, and Karam. Arvai means surgical procedures, Acne means cauterization, and Karam means giving some corrosive medicines applying at the affected area. These medicines are applied and employed in cancer therapy. In our hospital, we are treating the patients, for example, oral cancer. We are treating the people, and we have a good allopathy physician in our hospital. He is very interested in Siddha medicine. So we are integrating the Siddha medicine, give some internal medicine prepared from Siddha nanoparticles, metal and mineral particles, and increase the quality of life of the patient. And then what is Siddha diagnosis? In modern diagnosis, we are using a lot of MRI, lab investigation, X-ray, and etc. But in Siddha, you see a time-tested practices, and it is more than 6 to 8,000 of years practice, we can't say they are not scientific. They are used by our ancestors to diagnose the disease, very cost effective. That is N-வகை தேர்வு. In Tamil, we call is that N-வகை தேர்வு. That is examination of skin, examination of color and complexion of the whole body, examination of speech and voice of the patient, examination of eyes, examination of tongue, examination of feces, examination of urine, and examination of pulse. In this examination of pulse and examination of urine is the very important Siddha parameters to conclude the diagnosis. Apart from these diagnostic methods, Siddha system of medicine has some special characters according to the nature of the patient and according to the some humoral differentiation, that is Vadam, Pittam, Kabam. In Tamil, we can say as Vali, Alal, and Dayam. According to Thiruvalluvar, Miginum, Kurayinum, Noisayum, Nulur, Vali Modala, Enniya Mundru. In Tamil, the Vali is the Vada, is the main part of the disease. According to the following differentiation, that is humoral differentiation, Vadam, Pittam, Kabam, that is Vali, Alal, Ayam. And Ayambudam theory, that is Prithivi, Appu, Vayu, Teyu, Agayam, and relation with taste. Some 6 tastes and Nadi. The Nadi can be read in 10 places of the body, and the pulse felt in radial artery is very important to assess the disease. Neerkuri and Neikuri, that is diagnosing the disease using urine analysis and urine oil reaction methods. And the color of the diseased part. The color of the disease part is very important, whether the disease is related with Vadam or Pittam or Kabam. And then prognosis of the disease, that is nature of the disease and its progress. We can assess whether the disease is curable or incurable by Naikuri method. Balancing of humors. It is a very important treatment methodology in Siddha Sutama medicine, and we may call it as the first line of treatment to balance the humors. Balancing the humor is by elimination of toxins, that is detoxification therapy. And karma and its impact. Karma means the deeds of the patient. We are give simple some scientific methods counseling to the patient to relieve from deeds. You can see these 3 pictures. Most of the persons we can categorize that among these 3 categories. The first one is very long and dark in color. We may call him as a Vada Degi, that is Vali Degam. So the body has Vada humor. And the middle one is just fair and little shorter than first one and a little higher than third one. That is Pitta Degi. And then final one is very short. He is Kabadegi. According to the height, color of the skin, size of the body, reading the pulse, color of the skin, saliva, stool, urine, we can categorize the patients into 3 categories, whether they are dominant in Vadam or Pittam or Kabam. After that, we are using some method to balance the humors, that is Samana Marathuvam. Some method to eliminate the increased humors. In Siddha Sutama medicine, the entire life span is divided into three parts. First 33.3 months. If the entire lifespan is 100 years, then first 33.3 years is Vada period. And second 33.3 years is Pitta period. And last 33.3 years is Kaba period. See, we can logically say the overall lifespan is affected by influencing these type of diseases. In first lifespan, we may be affected with Vada diseases, and the second lifespan we may be affected with Pitta diseases, and the third lifespan, that is the last lifespan, we may be affected with Kaba diseases. So we have to use some detoxification therapies to eliminate the humors which are more, which are dominant in nature and causing some diseases to maintain its equilibrium. How we are balancing the body? That is elimination. Lot of elimination methods. For example, purgation, emesis, sweating. These are some elimination methods to remove Vadam, Pittam, and Kabam. And detoxification methods. We are giving some blood purifiers, antidotes, some internal medicine or external medicine to detoxify the toxins. And then conservation. It's a simple management of health by preventive methods. Immune enhancing. Lot of immune enhancing herbs and some practices like yoga, dhyana, all are giving immune enhancing boosters. And then antioxidation. Some drugs we may call as Kaya Karpa drugs, Siddha Kaya Karpa drugs, given to improve to reduce the oxidation and improve the antioxidation property of the cells. And finally, anti-aging. We are advising the patients to adopt Therayer as a one saint. He told about some preventive measures of diseases. That is Therayer Piniyanaga Vidhi. We ask the patient to follow the regimen. In general, for first line of treatment in Siddha, we are giving some therapies. For example, Vali humor, that is Vada humor, by resolving constipation. Alal humor, that is Pitta humor, by cleansing biliary and urinary tract. And then IM humor, that is Kabam, by cleansing sweat, phlegm, and saliva. There are some process, that is purgation to eliminate Vada, vomiting to eliminate Pitta, and sweating, spitting to eliminate Kaba. In general, this is the general principle followed in Siddha system medicine. The diseases seen in the head, that is above neck, are treated by Nashiam. It's a one process in which nasal drops, whether it is in oil form or any liquid form or powder form, is instilled into the nasal cavity to eliminate the toxins. The diseases occur in the thorax, that is in the chest, below the neck, and above the diaphragm. We can treat it with emesis, that is to induce vomiting. And then the diseases seen below the diaphragm and above the umbilicus. We can give medicine for purgation to eliminate the accumulated fecal matter in the small and large intestine. That is by purgation therapy. And finally, The diseases seen below the umbilicus and up to the pelvic area can be treated with enema, that is pichu. These are the four important methods according to the symptomatic representation received from the patients. We started, we are starting first line of treatment to eliminate the increased humors, which are dominant in nature. In Vada, there are 10 subdivisions or branches of Vada that is called Pranan. In Tamil, it is Muchikal. Abanan, it is Kilnokakal, Vyanan, Udanan, Samanan, Nagan, Kurman, Kirigaran, Devadathan, and Dhanajayan. We are giving some therapies for Pranan, breathing exercise, for Abanan, Pargasan, enema, for Vyanan, massage, that is physical manipulation and fomentation. In Udanan, we are giving therapeutic emesis. For Samanan, we are giving oil bath. Nagan, we are applying eye salve medicine. In Kurman, some ophthalmic drops. In Kirigaran, we are giving nasal snub. In Devadathan, we are asked the patient to expose the body in evening sunlight. It is entirely different from Ayurveda and Siddha. In Siddha, we are asked the patient to expose the body in evening sunlight and Dhanajayan to apply poultice on the body. In Alal Kutram, that is gastric juice, it may be relieved by emesis and impurities in the blood, that is Ranjaka Pittam. It can be removed by bloodletting, and then Alosaga Pittam, that is aqueous humor. It can be relieved by Kalikam, that is ophthalmic drops and eye salve, and disorders of bile, that is Prasaka Pittam, that is sunbath, and fifth branch of Pitta, that is vital force for now, Sadhaka Pittam. We can give in physical manipulation, that is massage and fomentation. And then third humor, that is the final humor, Kabam. It is Avalambagam. It is seen in serum. We treat it by Kurudivangal, that is bloodletting. The Kledagam, disorders of saliva, we are giving Vamanam. And disorders of limb, that is Bodhagam, we are giving therapeutic emesis. And then cerebrospinal fluid, that is Tarpagam, we are giving oil bath, that is Enne Muluku in Siddha. And then finally Sandhigam, that is synovial fluid, which is seen in all the joints, by giving massage, fomentation, and poultice. The above three humors and its branches are whether they increased in nature or decreased in nature, causing diseases. So the physician duty is to observe whether the kutram, that is vada or pitta or kaba, which is increased or decreased, and we have to balance it by elimination and giving some medicine to increase the deficient humor. Apart from that, and the end part of this presentation, we are giving diagnostic aspect of Siddha system medicine, in which 8 methods we are following. That is Ashtanga Paricha in Ayurveda. In Siddha, it is called as Envagai Tervu in Siddha. And the first one is Na, that is tongue diagnosis. In tongue diagnosis, whether the tongue is coated, whether the tongue is color, in which color, whether it has fissures or cracks, hypersalivation, deviation of the tongue, hyperpigmentation on the tongue. The all 6 parameters are The
Do the pranayama on kurchi, and then you can come down.
Sir, pranayama meditation I'm fine. But when
And you can mute Anirban.
hello, sir. Can you hear? Hello.
Yes, sir. Please carry on, sir. Sorry, there was
Go
a
ahead.
Okay. Okay. I think so. I am not hearing. The 6 parameters are used for tongue diagnosis. It shows whether the patient is affected by Vata humor or Pitta humor or Kapha humor. This is a simple presentation in which what are the mode of our diagnosis and how we are treating the patient. And then Nirakuri, that is the color of the patient. That is the color means whether he is in normal, that is black, yellow or fair. According to this color, the patient can be categorized into Vadam or Pittam or Kabam. And then any change in color, whether it is localized or generalized. And then Molikuri, that is examination of speech and voice of the patient. Because the people who are living in some places have voice, they are louder and some are very soft. According to this, the medium pitch or high pitch or low pitch. In diseased condition, some patients have low pitched voice. In delirium state, the patients have high pitched voice. So according to the state of the disease and condition and severity of the disease, the patient can be categorized into Vata or Pitta or Kapha. And then Vilikuri, that is examination of the eyes. In this, the examination of eyes includes color of the eye and moisture nature of the eye, burning sensation in the eye, some mucus excrement seen in the eye, that is mucopurulent discharge, change in the vision, protrusion of the eyeball, or any other eye disorders which can be observed. And then Todukuri. This is sensory diagnosis. It may be related with now modern doctors are doing just inspection, palpation, and percussion. And then Malakuri. The Malakuri, it is very important tool in Siddha medicine. As one Siddha verse tells about the change of high color stools in COVID-19 cases. This increased ferritin level in blood may lead to high color stools. It was already told in Siddha medicine by a verse by Agasthyar Nandiswar. The examination of pieces plays a important role to diagnose the disease earlier. That is color of the stool, hardness, softness, coarse, watery, and weight of the stool. The above 6 methods are normally used in Siddha medicine, and the remaining 2 in 8 type of diagnostic methods, Neerkuri and pulse diagnosis. That is urine examination and pulse examination is very important to doctor. It is similar to imaging science in modern medicine and electrocardiography in modern medicine. Siddha uroscopy is mere imaging science in which the testing process could be captured and documented. The advancement on Siddha instrumentation science may bring an uniform standard procedure to test the studies and also interpret the result. I will share some slides of the photos. Siddha uroscopy, it was told 7,000 years back by Siddha Agathiyar and Therayar. That's analyzing the urine by naked eyes and change of urine surface in oil urine test analysis. That is in Neerkuri, color, froth, weight, odor, and the frequency of urine. All are observed by naked eye. In Naikuri, 1 drop of gingerly oil is put on the upper surface of the urine. The reaction taken on the surface of the urine, that is direction of flow of urine or splitting or sinking or any changes on the urine surface may be correlated with some interpreted points which were already given by Thereyer in his Thereyer Nirkuri Naikuri process. They all are indicators of number of diseases. There are 134 patents mentioned in Siddha system of medicine to conclude the diagnosis. And then finally, Nadi Kuri. That is, this is the one physician's skill for earlier diagnosis to assess the disease. This pulse diagnosis is very important for a patient to assess the disease, prognosis of the disease, and also assess the serious illness of the disease. Most of the Siddha physicians who are trained in pulse diagnosis can tell whether the patient will be fatal within 3 days or 5 days according to the seriousness of the disease. The pulses are felt in the body in 10 places. For example, in ankle, genitalia, umbilicus, chest, earlobe, nose, neck, hands, eyebrows, and center of the scalp, that is in crown. But practically, Siddha doctors practicing arm pulse, that is radial artery, because which is superficial in nature. The following arteries, that is anterior fontanelle in infant, supraorbital artery, temporal artery, orbicularis, muscular angular artery, carotid artery, axillary artery, abdominal artery, radial artery, femoral artery, and the posterior tibial artery are the places for reading pulse. Radial artery is generally practiced in Siddha medicine to assess the disease. This is the method of reading pulse. This is the index finger, middle finger, and the ring finger. It's the right hand of a male patient. For a male patient, the right hand is used to reading a pulse, in which the index finger denotes vadam, that valley, and the middle finger indicates pittam, and the ring finger indicates kabam. So vadam, pittam, kabam. The pulsation feel in the 3 fingers may be correlated with movements of some animals, birds, movement of tree, movement of robe. So our ancestor told the resembling of some movement related with the pulse to denote the disease. This is one method of observing vadam, pittam, kabam. Before that, we have to catch the thumb to read the pulse sharply. In this method, we can feel 5 pulses apart from vadam, pittam, kabam. The 2 pulses we can say as Bhudanadi. It is very important to diagnose a patient whether the patient is hysteric or psychiatric patient. rather than physical illness. The thumb and a small finger may show the severity of diseases rather than physical illness. The patient may be affected with some psychiatric problem. This is the one finger in which the Vadanadi or the Pittanadi or Kabanadi by moving the three fingers can be assessed. In early stages, we can assess the patient by this method. This is a method in which the Bhudanadi only can be assessed by a physician, whether the patient is psychiatric patient or physical illness. In this method, the pulse can be felt by a different approach. This is the pulse reading for a female patient. The left arm is used to read the pulse. For female patient, we are reading left arm of the patient. In male patient, we are reading the pulse by the right arm of the patient. The pulse is the reflection of 7 udal kattugal, that is 7 body constituents and 10 pulses and 3 humors, which are received in the form of waves in the radial artery. This is the essence of the whole body. We can see it is a primitive level or a mature level.
To Venkatesh, you have
Yes.
another 5 minutes for presentation.
Yes, sir. I'm going to close it. The remaining are pictures. These are 5
Okay.
points in which the pulses can be felt. According to this, the area which is head to thorax, that is kabam, the thorax to umbilicus, that is pittam, and the umbilicus to pelvis, that is vadam. If the pulse is different in nature, the patient may be affected with the following diseases in the particular or specific area. This is one concept in which vadam and pittam kabam is controlled by the goddess, in which it is a production and protection and also destruction of the body cells. We can simply say the reading pulse is similar to pressure of the heart exerted in the circulatory system. This is the normal pulse in which vada is 1 part, pitta is half part, and kaba is quarter part. We can assess this by a wave in the radial artery, that is vada, pitta, and kaba. In Siddha, we can tell us vali, alal, and ayam. That is vali is one matrai and half matrai, and kabam is quarter matrai. This is the normal physiology of the pulse. That is, if Vadanadi is double, then the patient is affected by Vada diseases. If Pittanadi is double, the patient is affected by Pitta diseases. And then Kabanadi is high, the patient is affected by Kaba diseases. These are 10 type of Vada, Pitta, Kaba, Kaba Vada, Kaba Pitta, Vada Pitta, Vada Kaba, and Mukutra. 10 types of nadis can be found in all the patients. This is the method. For example, this is the one type of pulse which can be correlated with the movement of leech. This is one type of pulse which can be correlated with movement of worm. Apart from the pulse reading, this is Naikuri. So one drop of gingerly oil put on the urine surface. The pattern obtained can be compared with some parameters data already told by Siddhas. That is hen pattern, bottle gourd pattern, the bad pattern in urine diagnosis. That is banyan leaf pattern. That is dog pattern. Say PL pattern, PL in ring pattern, chair with lion sign pattern. These all are some type of patterns received in Naikuri analysis. So we can conclude whether the patient have good prognosis or bad prognosis, whether the disease is serious or not serious, whether the disease is related with Vada or Pitta or Kapha. We can diagnose the disease without asking any questions from the patient by using this type of diagnostic methods, that is pulse diagnosis and urine diagnosis. At the end, Siddha is the popular medicine in Tamil Nadu. It is one of the ancient system of medicine in India. It's one of the Indian system of medicine. And most of the people in the southern parts of India are using Siddha system of medicine. We have a lot of drugs in herbs, animal sources, and also metals, mineral sources. We have a lot of research platform. We have a lot of integrated approach in treating the cases using Siddha medicines and modern medicines to manifest the diseases which are challenging to human era. Finally, I would like to tell knowing Siddha physiology, adopting Siddha pathology, correlating modern science, utilizing classical medicines, dialogue with some Siddha terminologies should be the goal for successful Siddha practice, and we are using it for better ailment of the patient. Okay.
Thank you.
My sincere thanks
you,
to
Dr.
all of you
Venkatesh.
for your patience and listening the presentation. But it is my first presentation in this group of people because my most of the presentation in Siddha people. I don't know whether it is understandable by you or not. I don't know. But this is the simple, basic principles and fundamentals of Siddha medicine. We can explain in detail in future presentations.
Thank you,
Thank you, sir.
Dr. Jeyavenkatesh, for a very throwing light on such a difficult subject, almost unknown. I knew because of my personal exposure to it just a year back, but still it's a wonderful to hear from you and given such a detail at the same time such a mystical way people taken care of our health and diagnosis all this area. So there are multiple questions. So I'll try to see the chat box and if you can answer one by one. The first question was from me, which is not an understandable term for me. You talked about the balancing the humors or deranged humors. What do you mean by humors?
Sir, humor, but it is, we can simply say some essence of the body. If the essence of the body, if we are discomfort with flatulence in the body, then it may be due to flatus which are rich in intestine. So we may call it Vada.
Okay.
If our bladder is filled with urine, we can't control the bladder. It is very rich with Kapha. If we have more saliva in the oral cavity, we can't control it. We can swallow or spit. That is Kapha. So the Vada, Pitta and Kapha is entirely different in particular place.
Okay, so
Okay.
that is balanced.
We can simply define whether Vada is one, Pitta is one, or Kapha is one. According to the place, it has various dimensions.
Okay. Okay. There is another question, which is what is the specific thing in the pulse which is Siddha practitioner notice? Example of a cancer patient, how the pulse will be different from a completely healthy person. Can you throw some light?
Sir, sir, in my experience, whether a medicine gives complete remedy to cancer or not, but we can increase the quality of life of the patients. For example, in acute myeloid leukemia, the survival of the patient is not more than 120 days, more than for only 3 or 4 months. But in our Siddha medicine, we can increase the span of life up to 3 to 4 years with the integration of modern medicine uh, to managing some difficulties like blood transfusion, etc. Using modern medicine. Some medicine in Siddha gives relief for quality of life. It's more than 3 years to 4 years.
Okay.
Not only that, a lot of cases in
Yes,
a lot
but
of cancer.
the question is not the treatment.
Yes,
Question is on the diagnosis. The
yes, yes.
diagnosis when
Good.
you do the
Fine,
pulse,
sir.
how
Fine,
it is
fine.
how it is different how it is different from the Siddha practitioner to see the difference of the pulse for a healthy person and the pulse of a cancer affected person. What
Yes,
kind
sir.
of difference you
Fine,
notice?
fine, sir. In Siddha, in cancer patients, we can yearly detect it by urine analysis. In urine analysis, we put already I told about the one put one gingerly oil on the urine surface. That is some patterns. For example, one pattern is fan-like pattern. That's the pattern in which the urine start rotating itself. And one more pattern that is sieve tube pattern. In both patterns are the indicators of malignant diseases. So it is the alarming point in which we ask the patient to do scan immediately and particular part or to do FNAC or bone marrow to confirm whether it is malignant or not. But most of the cases, the Siddha diagnosis gives earlier detection of cancer.
Okay. Okay. I think the question is answer is much more clear right now. So there is one more question telling that what are the results you found for treating autoimmune disease and cancer? What's your experience?
Uh, for autoimmune diseases, sir, we are giving some external therapies, sir. You know about some external therapies that is Varma therapy. Varma therapy in Tokkanam. Varma therapy, it really helps the patient for autoimmune diseases. For example, in rheumatoid diseases and psoriatic arthritis, the patients are really improved by some external therapies. Um, More than that, it may take some more time to treat the patient. For example, if some knee arthritis or osteoarthritis, the patient need 3 to 6 months treatment. In some autoimmune diseases, the patient may need 3 to 4 years of treatment. But we can
Okay, but
completely cure them without any painkillers or immunosuppressant drugs. If they are
okay,
undergoing immunosuppressant drugs, we ask them don't drop it immediately and ask them to tapering it with their physician advice.
okay. That's good. But at the same time, because you have a lot of metallic components also, do you see any side effect or adverse effect during the
Uh,
course of the treatment?
yes, sir, you are correct. We are also observing some adverse reaction on your drugs. You are correct. But meanwhile, this is the therapy, treatment methods, and drugs which are available in Siddha Sutama medicine. But it is depends upon the physician's dose and some diet restrictions should be adopted by the patient. It's very important because some medicines should be given only for 3 days. Some medicines should be given only for 7 days. The dose is 20 milligram or 50 milligram or 100 milligram only. So we have to observe it carefully. Then only we can give without any side effects or adverse drug reaction. Otherwise, we shall meet the side effects and we have to manifest it by using some medications.
Right. Okay. Next question is this form of medicine available outside Tamil Nadu?
Now it is available in Delhi, Andhra, Karnataka, Kerala, sir. And now it is available. Now Goa also started one Siddha outlet center now. In Gujarat also they are going to start one more Siddha center now. Now it is developing to get in other states. But instead of that, we can get medicines in Singapore, Malaysia, and Sri Lanka. But Siddha medicines are available in that area. Because of when Tamil people are more in that area, so we can get.
Right. Yeah, yeah. People awareness and their acceptance you need and that sort of faith in that treatment, then only it will work best. That's good. I have one more question from one of the other participant telling that facial examination, what is it used to diagnose for? As in general, we do facial weight checkup for estimation of dietary fiber and bacterial pathogenesis. The same way, what does Siddha medicine diagnosis they do?
No, sir. According to Siddhar's concept, the patient should be viewed by two eyes of a physician, and one eye is science, and another eye is Siddha philosophy. So initially, we start the patient with diagnosing Siddha philosophy. For example, the face diagnosis, not only appearance of the face, it involves any changes in the face, abnormal changes in the face, deviation of the lips, abnormal movement of the eye, any palpitation in the eyebrows or any part of the body, all should be assessed. More than that, we are assessing whether the patient is Vada or Pitta or Kapha according to the expressions made by him in the face.
Okay. Now there is one more question because a lot of people are aware of Ayurveda. So how this treatment is different from Ayurveda in general? Can you just highlight?
Yes, sir, correct, sir. So, for example, linguistically both are different. First point, and then in philosophically some points are different from Siddha medicine because in Siddha medicine, first period of lifespan is Vada. In Ayurveda, first period of lifespan is Kapha. These are entirely different. In Ayurveda, the medicine is based on mostly herbs. In Siddha, the medicines are prepared from herbo-mineral compounds. And then Aristom, that is alcohol-based medicine, is popular in Ayurveda. And decoction, that is Kashayam, we make concoction. Medicines are familiar in Siddha. So, it's philosophically and medically, some difference are same in Siddha and Ayurveda, but both are daughter of single mother.
Okay, yeah. Yes. I think we have many more questions maybe coming up, so we'll post you if you have much more questions. But I really want to thank you for enlightening us on this such ancient way of detecting and treating people, very with a minimum invasive and at the same time taking care of the patient by continuously monitoring and taking care. So with these few words, I'd like to thank you again for your wonderful explanation of what is Siddha. And
thank you, sir.
We learned a lot about this. And I request Anirban, if you have any announcement or anything to make at this stage. Anirban, please.
Yeah, thank you, Dr. Jeyavenkatesh, for this very nice presentation and making us aware of this particular science, which I think many of us were very curious about what it is, and I think it's a very good introduction. And as you said that If there are some more details required, we may continue with you as we go along. And if we have a subject in place, I think you can be dwelling on the subject a little bit more deeper than what you have dwelt today. Today was just a basic introduction, as you said. There are a couple of more questions, Dr. Subhuta, you would like to take now, or should we?
Please, sir.
So there is one question from Sayani. She says that in facial examination we do estimation of dietary fiber and bacterial pathogenesis.
That I have already raised.
Yes, sir. It was already.
Okay, it is done then.
Sir.
I think we are through then, sir, more or less.
Yes. We are through, and I think we are also gone through our quite a 24 minutes extra because of a new subject. A lot of us took time to understand. So with this few words, I like to thank all our participants also, both internal participant and external members who joined. And also thank you, Dr. Jeyavenkatesh again.